What is electrolyte imbalance in chronic kidney disease, CKD? Imagine your body as a finely tuned machine that depends on tiny minerals to keep everything running smoothly. These minerals are called electrolytes, and they include potassium, sodium, calcium, magnesium, and phosphorus. In healthy kidneys, these electrolytes are carefully balanced by filtering excess amounts out of your blood. But when someone has chronic kidney disease, or CKD, the kidneys start to lose their ability to do this job properly. As a result, the levels of these minerals can become too high or too low, leading to what is called an electrolyte imbalance. The most common and concerning imbalance in CKD is hyperkalemia, which is when potassium levels in the blood become too high. Normally, the kidneys help keep potassium in check by excreting the excess. But as CKD progresses, the kidneys can't remove potassium efficiently, causing it to build up. High potassium levels can cause symptoms like muscle weakness, fatigue, and stomach cramps. In severe cases, it can interfere with the heart's rhythm, leading to dangerous arrhythmias or even cardiac arrest, which is life-threatening. Other electrolyte imbalances include hyponatremia, where sodium levels drop too low, which can cause confusion, headaches, and seizures. Hypermagnesemia, or high magnesium, can lead to muscle weakness and low blood pressure. Hypokalemia, or low calcium, can cause muscle cramps, numbness, and bone problems. These imbalances happen because damaged kidneys can't properly regulate these minerals and fluids. For example, when the kidneys can't filter out potassium well, it accumulates in the blood. Also, CKD can disturb calcium and phosphorus balance, which can lead to bone disease and calcifications in blood vessels. Medications used to treat CKD or its complications can sometimes make electrolyte imbalances worse. For example, certain blood pressure medicines like renin-angiotensin-aldosterone system inhibitors can reduce potassium excretion, increasing the risk of hyperkalemia. Symptoms of electrolyte imbalance can include muscle cramps, weakness, nausea, confusion, swelling, and irregular heartbeats. Because these symptoms overlap with other issues related to CKD, doctors usually detect electrolyte problems through blood tests rather than relying on symptoms alone. Managing electrolyte imbalance involves regular blood tests to monitor mineral levels, dietary changes such as limiting foods high in potassium or phosphorus, adjusting medications, and sometimes dialysis in advanced stages. Dialysis helps remove excess electrolytes and fluids from the blood, helping to restore balance. For those with kidney disease, maintaining proper electrolyte levels is vital because imbalances can worsen kidney damage and make treatment more complicated. It is especially important for people with kidney cancer or those undergoing treatments that may affect kidney function to have their electrolyte levels carefully watched. In summary, electrolyte imbalance in CKD is a disruption of the normal mineral levels in the blood caused by impaired kidney function. It can range from mild symptoms like muscle cramps to severe issues like dangerous heart rhythms. Proper management through medical care, diet, and sometimes dialysis is essential to prevent complications and support overall kidney health. If you or someone you know has CKD, it's always best to work closely with healthcare professionals to keep these minerals in check and protect your health.